Hello everyone and welcome to the channel. And in my today's video I am sharing an amazing prone 3-stage traction mobilization for the glenohumeral joint for the patients who are having frozen shoulder, bursitis or arthritis in the shoulder. So let us start with the manual therapy skill of this treatment. So for the treatment purpose, the patient is in the prone lying position and the affected shoulder will be hanging outside the bed in this manner. Make sure that the hand does not touch the ground. It is in the hanging position like a hinge. So now the therapist has to grab the patient affected side shoulder in this manner. The finger has to interlace the axilla part and the thumb has to be placed on the proximal humerus on the deltoid. Now make a cup, and now the therapist has to apply a downward traction force, a pulling force towards the ground, and make small arcs in adduction, in abduction, adduction, abduction, in adduction way, in abduction, in adduction, in abduction, in adduction, induction. So what you have to do, you have to pull the shoulder downwards and make small arcs in abduction, adduction, abduction, adduction, abduction and adduction. When you complete this cycle, so at least perform 15 to 20 times. After this you have to perform the shoulder in a clockwise manner and in the anti-clockwise. So you have to apply a downward pull to the shoulder joint. Now move the shoulder in clockwise direction in small arcs. Now slightly bigger and more bigger, and now anti-clockwise, the small arcs, bigger arcs and more bigger. So this is the second step. And the third step, you have to make figure of 8 in the shoulder joint. So you have to pull the shoulder downwards from the glenohumeral joint and make figure of 8. Maintain the pull towards the ground and apply this mobilization. So this also has to be done for 15 to 20 times in single session. So there are 3 steps. First you have to distract the shoulder joint towards the ground and make small arcs, abduction, adduction, abduction, adduction, abduction, adduction. And second step, you have to move the shoulder in clockwise direction, small arcs, then big arcs, and then even bigger, and then anti-clockwise. This is the second step of mobilization. And third step, you have to make figure of 8 in the glenohumeral joint and relax. So try this amazing manual therapy skill in the patients who are having frozen shoulder, and let us know your valuable feedback in your comment section. Till then, stay connected and thank you.